The Pallium project has evolved into one of Canada's most robust examples of a community of practice. COPs are collaborations of people who share specific interests and practices and work together to advance their specific area of practice. A COP reflects a long tradition of working together in Canada among neighbors and within communities to share resources, energies, and efforts in mutual interdependence of common goals. It reflects a great paradox of our times. The simple idea of diligently working together to reframe the complicated question of how can we afford to provide services to an aging population into one which enables us to navigate the complexity of ensuring that systems of care are available when patients and families need them. In this report back to stakeholders, several collaborators in project activities share insights about the project's work, results to date, and the difference it is making.
Well, one of the biggest challenges in providing palliative care in the rural regions is the lack of 24-hour coverage. And one of the ways that I see this as being possible is to enhance the 24-hour coverage in the rural regions is the telehealth nursing project.
That we were able, through Pallium, to leverage some ideas, dreams that we both, the Alberta Cancer Board and BC Cancer Agency had, and move them forward. The telenursing protocols project, that was something that initially was a dream of this ABC, we call it the ABC, Alberta, British Columbia, and Pallium give us the opportunity to leverage this original idea that, that was shared with other nursing leaders.
A group in Vancouver, we discovered, had started a small pilot project doing exactly this. And they had some early outcomes that were remarkable. So we built on what existed rather than reinventing.
The surprise maybe was how much agreement there really was about what was needed, and always what you find, I think, when you start talking to people is that your problems are probably more similar than you think. And in some ways the solutions are too.
To be able in the middle of the night, if somebody is dying at home and it's 43 below and there's a blizzard, and you live 243 kilometers from your nearest tertiary center, you can call and have a nurse on the end of the line who will, very calm and with confidence, competence, compassion, and she will have a slate of palliative care specific information to guide you through.
And it will practically mean that, especially patients in rural areas where there is no after hours and night service, it's going to mean they've got a number to call, a place to get reassurance. It doesn't mean that we can always handle everything over the phone. But our experience in Fraser Health is that about 50% of the calls can be handled just by a telephone call.
We believe in it, we know there's a need, and we know that most people in our country have phones. Now it's to talk to the health lines about how are they going to take these protocols and build it into their system, and it is doable.
When we can go with a product to ministries of health and call centers and say, hey, we have a workbook, we have a tool, we've done this work somewhere else, let's explore taking it up. Number one, that really gives them a challenge to take it up.
And I am grateful to this initiative that we've had the opportunity to even think about this kind of cutting-edge, frontline, easy access medicine.
I think there is potential for it to be Canada-wide. The principles and the developmental work that we've done could be adopted anywhere. And I've kind of used the analogy of a car. We built the prototype of a car, but obviously the model and the paint color and whether you need a block heater or not is going to depend on where you buy the car and where you're going to run the car. So we know that other provinces and other jurisdictions might need to do it somewhat differently, and that's okay.
If Pallium would have not been there, the telenursing protocols, which is so crucial for 24/7 access to for patients, would have never been implemented.
I think it will also ask other jurisdictions and regions to say, what services are you providing for patients overnight? And it will force them to answer that question. And if the answer is no, I hope they'll do something about it.